Mr. Hassan Zaggi, president of the Association of Natural Health Journalists, says the media risked it all for the good of humanity to report all issues concerning the COVID-19 pandemic in the country. Zaggi said this at the opening of a 3-day annual health conference of ANHEJ on COVID-19 reportage assessment in Goshen City, Nasarawa State.
The media risk all for the good of humanity. It was indeed very tasky that even though a journalist will be obeying the lockdown rules, he's been expected to get the needed information and disseminate same so that the people can be able to protect themselves from the pandemic. We had to develop ingenious ways of getting the right information to the people. In the process, journalists, especially those covering the health sector in Nigeria, were overstretched. Some even contracted the virus.
He said health reporters did their best working with medical and health experts, health-related government institutions, and critical stakeholders in the health sector.
By our own assessment, we did our very best within the circumstance we find ourselves by working closely with medical and health experts, health-related institutions, and critical stakeholders in the health sector to ensure that our people are well informed about the coronavirus. However, considering that the COVID-19 cases in Nigeria are on the downward trend, even though there is a global warning to be prepared for a second wave, we feel it is time for us to examine what we have done so far.
Mr. Godwin Odimeji, the chairman of ANHEJ board, urged journalists to be more involved in investigative reporting.
Today, we are in another phase of what we are here for. One of it is that COVID-19, it brought out a different thing altogether. That you no longer gather like this. They call it a press conference. Most of the conferences we have done is by virtual meeting. So you have to develop another strategy of doing that very well. We have to show more interest in investigative journalism.
Mrs. Mojima Kanjuola, the Chief Executive Officer, International Society of Media in Public Health, commended journalists for effective reportage of COVID-19 issues in the country.
I'm happy that you have all come to the realization that we need to mirror ourselves so that we can do better. I think that's what we are doing here today. I do hope that the lessons that we will learn from this 2-day assessing COVID reportage in Nigeria would go beyond COVID. It will strengthen us to do our work better. So I hope that we'll be able to use the next 48 hours to close up on a lot of gaps that we have and do more until, of course, we as health correspondents project health as mandatory, project health as an investment. Nobody is going to do that for us. So I hope that we will continue with the good work that we are doing and do much more. Much more is expected from us.